starting, we're going to start with the easy one. In your packets, you'll see the included the two products that we're going to be using for cleaning. And I know everybody's going to say, well, I've still got a case of. Yeah. All right, I know everybody's been doing, some people may have been using your caddy wipes, your sandy wipes, some are using the bleach products. Like what Betsy said, we want to become uniform, we're all one organization, everybody's going to be using the same thing. We did some studies, we've met with people, so the products that we're introducing here and the products that we picked were picked on based on what they kill time, not because they're cheap. And they're not cheap, so I don't want you to think that's how they were picked. So one of the brand that we picked for your general cleaning is going to be the Clorox-based wipes that she's holding up, the Clorox, which is a hydrogen peroxide. All of the brands are a Clorox product. We'll try to get to that slide. Sorry, this is done by. All right. It's the Clorox Healthcare Hydrogen Peroxide Cleaner and Disinfectant. I was showing this to Eunice, and she was saying, "Oh, is that what you're going to use?" She said, "Great, that's what we use in the lab." And I've heard people comment, you know, it's hydrogen peroxide. What does it kill? It's not going to kill anything. Well, it does. And I want you to look at it. You've got on your sheet, it talks about the different organisms and the bacteria and the viruses that the hydrogen peroxide does kill. You look at your bleach products, bleach doesn't kill as much as what the hydrogen peroxide does. So the hydrogen peroxide is what I want everybody to be using for their general cleaning. Now, we did pick another product for when you have C. diff and pertussis patients, or if you suspect this patient has C. diff or pertussis, we're going to use the Fusion. Now, this is expensive. This isn't cheap. This is not for you to do for your everyday general cleaning. It's not for you to go use a wipe, spray some Fusion, and then take a Clorox wipe. You're not going to do that. If you're using the Fusion, it's because you have a patient that you suspect has C. diff or pertussis, and that's when you're going to use it. Otherwise, you're going to use that hydrogen peroxide wipe or spray. It does come in a wipe or a spray. You can order both, but if you order both, you don't spray and then you use your wipe, the same thing. You're going to use your paper towel. Of course, you're going to spray it, you're going to let it sit. You want it to have the wet time to make the kill. Most of the kill times are within 30 seconds to 1 minute with the hydrogen peroxide, so make sure you're leaving it wet. And then you're going to you're going to wipe it and leave it wet. You want to let it air dry. What we would like to see happen is when your patient leaves the room, that's when you do your cleaning, not 10 minutes later when you're getting ready to go call another patient, let me go clean the room. When your patient leaves the room, clean your room. That includes your doorknobs, your bed, everything the patient may have touched, not just the bed where you're going to pull your sheet down. You allow it to dry, you go get your patient, hopefully, you know, it's 2, 10, 5 minutes. By the time you get back to your room, it's had its kill time. And it's satisfied. So any questions on that?
Which one do you use, like if you have bed bugs in your room? Like, you know, we have cleaners right now, we have cleaners. Yeah, that's wonderful.
What? It's not gonna make any difference which one of these you use, because you're not gonna try to kill the bed bugs. If you have bed bugs, you have scabies, we can handle that. None of this stuff is gonna kill that. This came from somebody's home and blah, 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 blah. We just need to know that so we can have, Adams or somebody come.
And there's not a product that's going to kill your scabies. It's not. It's just not.
Well, I understand what she's saying. When a child comes in with scabies and they've been scratching and they're having fluid out, she's saying which one of those.
You can use your hydrogen peroxide water.
So after every patient, instead of using the purple top we got in the office, we use the green top now.
Right.
Okay. Wipe down everything that we would normally wipe down, the bed, the chair, everything that we normally, with that.
Phase out what you have, use
Okay.
what you have, don't
Yeah.
get rid of anything,
Yeah.
and start ordering these. Marilyn is gonna know that we talked with her with all this stuff, she's gonna know that this is all you're supposed to order of these products that we have here.
Are they on the Henry Schein website?
Yes, they are.
We met with them, me, Lisa, Nancy, Marilyn. Met with all of them. So what, Vicky?
The products are just different every time she's changed.
Yeah, but she's not gonna change now. We got all of this together. You're supposed to be able to only order these products. She's supposed to see to that. And that I don't do that. I'm not familiar with how you guys order. But we've all spoken to her and she knows that these are the only products that you're supposed to
Or
order.
I'm shopping at Walmart.
Well, the products are it's gonna be taken off. You won't have the ability to order your cavity wipes and your standing wipes. This will be what you have, what you can order. We're gonna start limiting what everybody can order, because, you know, Edison may like the standing wipes, and you may like the bleach, and you may like the cavity wipes, but we're not gonna do that. As an organization, we're all gonna use the same product.
What can't be surveyed, will never pass survey if someone else is doing something differently. It raises a red flag. Can't customize for what they do. It's just like any hospital you go into, they all have one cleaning procedure, they all have one set of products. You know, people from the hospital working on the third floor, are gonna go out and buy what they want to use versus people on the fifth floor, okay? We've got centralized products that we're using.
They're expired, we made on the white road.
Hang on, let Lisa finish her presentation, okay? And then we'll have a question.
All right. The other thing that we're going away is that, what's that spray called? The, Citrustat spray that we've been using for odor. We're not gonna be using that anymore because it has an oily base, and people have a tendency, when you wanna get rid of an odor, you're gonna spray a lot. Well, when you do that, you're leaving an oily residue, you're leaving people may slip on it, it doesn't dry as well. We're going with the Clorox disinfecting spray. It has a very pleasant odor, it's not overpowering, it's not gonna bother you people with respiratory issues. So this is what we're gonna use. So stop using your Citrustat, and you're no longer gonna be able to order that. We're gonna use the Clorox disinfecting spray. So. As you can see in your handout that we've given you, it talks about the Clorox disinfecting spray, where it kills as well. But that's not what we'll be using it for. In the near future, not right away, we are going to start using the Alligard soap and the Alligard hand gel. The Provone is being phased out. We're no longer going to have access to the Provone. But in the meantime, while we still have the Provone product, that is what you're going to continue to use, because that's what, you know, the wall mounts for our hand sanitizer and our soaps, that's what we have. So you'll know when that's going to be phased out. But the Allogel, the Alligard has really good quality as well. And I think you'll like it probably better than the Provone. And this is just on your hydrogen peroxide wipes. It gives you your order numbers for everything. So in your packets, in your handout, if you're responsible for ordering, pay attention to that so you can find out where to order it. Do your order numbers. And just remember, please remember, the Fusion Cleaner, you've got the information on the Fusion Cleaner. It's strictly for, what are we using it for? See, different pertussis. Okay. All right, questions?
Question?
Go ahead.
Do we have an expiration date on the bottle once we open?
The cavity wipes are good for 2 years. Or not cavity wipes, I'm sorry. The hydrogen peroxide wipes is 2 years after open. And you do still need to date it when it's open. Just know that you got 2 years. And if you go 2 years without emptying that bottle, we got a problem. And, yes. This way, sorry.
I just ordered a whole case of the wipes the other day, that the I didn't send those back. I don't know.
Go ahead and use them. Use what you have.
And when y'all reorder these products that you're doing, okay?
Right. If it's time to place your order, then this is what you order. Use what you have in your clinic. Do we want to tell them go ahead and get rid of the Citrustat, or?
How many people still have it?
We sent ours back out.
The problem is, I don't want, because our money is tight, I don't want anybody to think that we've been wasteful. We've used it all this time. If you use it, spray it into the garbage can. It still has that kind of odor. Spray it into the garbage can, use what you have, and don't order any more of it. Does everybody still have a few cans?
Yeah. What Pat just said was use what you have.
10 to 12 things, do you?
Ma'am?
I was somewhere the other day, I can't remember where it was, but
Okay. Use what you have. She said spray it into your trash can. Don't spray it wide into the air because when you do, the residue falls on the floor, falls on the table. Spray it into your trash can or into a commode, wherever you're using it.
Well, that's dangerous too, because it's so slick that if it gets on the rim, you will slide off that thing like a rocket. I ain't kidding. Did she talk about the arm?
I'm not bringing the rim. Go into your commode.
this product right here, one of the reasons why we chose this over the plain Lysol, it's a new product and it doesn't have that strong odor that Lysol has. You gotta think about your babies with their respiratory and their asthma problems as well as your COPDers and asthma patients. And folks get, real happy it really only takes just a little, it goes a long way, a dab will do it. But it doesn't have that overpowering odor that's not choke you when you got too much of it already.
Yes, it's really nice, real pleasant. Just said,
Okay, I just want to be clear. Okay, that's blue spray, we still keep the vial, whatever it's called, a little blue spray.
But it will be phased out.
no,
Okay, so no more ordering
no.
that. Only this.
Mhm.
And what's gonna happen is Maryland's gonna disable all those other products. Okay?
No more of that, no more blue spray.
What you're
And
seeing
we're
right
really
now,
tried,
what you're seeing right now, the Fusion, this right here, the wipes, the hydrogen peroxide wipes, or the spray, you can order both, 4 things.
Okay, and that's the only size can that is gonna come in.
yeah,
It's harder than the city that though.
yeah.
It is, that's what we get, that's all we have.
So it'll last long. The products that we've chosen, I mean, they have a really good kill time. I want y'all to understand that. And it's gonna be better than your bleach right, what you've been using. Especially if you use it properly. No product is good if you don't use it properly.
The Fusion is the latest thing that's come out, most all the hospitals are going to Fusion, for those pertussis and things like that. So they promised us that they, will have plenty for us to get, but it's the newest and latest thing because it doesn't have those odors that other products do that are irritants to patients.
Yes.
Is it 2 years after opening?
Yes, 2 years.
But don't let it really be, pop open and have them dry out and all that kind of stuff too. And another thing I like to say to you guys, I would as a provider, you guys go to providers about something that we have pulled or we have done, or an email that one of us has sent, and then that provider is calling Betsy or emailing, Lisa about this, that, and other. We're not gonna have you stop doing something that's gonna be against our quality patient care that we provide. I sent the email out saying that about I guess the blue light or something. And right away, somebody went to Dr. So-and-so and then got on the phone and sent an email, blah, blah, blah. Please understand, if you have a question about something that one of us has sent out, email or call us. Don't have to email and call us because they don't even know what we do, what our processes are. And if you don't understand it, call so we can explain it to you. If you don't understand something about what we said about the product stuff this morning, ask Lisa. We met with people 2 or 3 times. We've gone over the kill times and mulled through it and met again and made a decision, looked at all this information backwards and forwards. So please, 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 if you have some issue about something that one of us has sent out, email or call us, don't go to one of your providers and say, they're pulling this and we need this for this reason. We have already investigated the reasons why you need everything. We didn't just, we didn't just start doing this stuff. We know because of our infection control issues, the kinds of things that we need to heal. It's not like we have never dealt with pertussis or TB or C. diff and all this kind of stuff. We know this. We're gonna look for short times to kill all those things. We know we need to get the patients in and out. Right? So please email us or you call us. Don't have a provider calling us about, we can't heal this, and this. They don't know that we've already looked at it. And it's very frustrating. It spends us time during our day to try to get back with them and try to explain when we've already done it. So you call us so we can explain to you or email us so we can let you know what's going on with it. Because we're gonna have multiple meetings with a few of us before we decide on something and then send it up to you. By the new product.
Oh, I thought it said, okay.
All right,
Video is an overview of monthly maintenance for your autoclave.
all right. We'll do the video after we discuss this. I want to reiterate what Betsy said. We found we do have issues with the sterilizers and the cleaning of the sterilizers, the maintenance of the sterilizers. We want to make sure everybody is doing the same thing. And our goal is going to be not to have one or just two people in the clinics that are doing the sterilization maintenance or understand it, because, it's supposed to say Edna does it, she could be on vacation and she could be off, she could be in the hospital, your other person may be out. Well, who's gonna do it? You gotta have, everybody's gonna be trained, at least familiar with it and understand it. So you need to arrange that training in your clinics, to get the other nurses trained, not just Vera and Diane and Mary and Word. It needs to be Bobby and Nita, want everybody to understand the sterilizer and what they go through and what they do. Maybe you'll be a little bit more sympathetic to them. In your packet, you'll find 3 pages related to the sterilizer that I put in there. One of them shows your weekly autoclave maintenance. We are going to be doing weekly autoclave maintenance weekly, regardless of if you use your autoclave that week. If you use your autoclave, let's say you were off or you didn't use your autoclave this week, then you come back the next week, you have equipment, are you gonna take the time to do your autoclave cleaning before you sterilize that equipment? You're not. So let's set a day, pick a day, what day is better for you, set assignments of who's gonna do the cleaning. Do the cleaning once a week. And as you do the cleaning for the weekly autoclave maintenance, it gives you your steps, tells you what's needed to be done. You're gonna clean your external surfaces, you're gonna do your chamber wipe down, you're gonna clean your door gasket, you're gonna drain and refill the water. And then where it says initials, I want you to cross out initials, I want you to sign it, not just initial it. And make sure you do that in your book. There's been some confusion about where you're logging, where you're putting your maintenance, where is it documented. I've gone into clinics and the only book that they're using is the biological indicator book. That's where you're indicating that you're doing your cleaning. That is wrong. You use the red book to document if you've done your cleaning. Everybody should have a red book in their clinic that has a sterilizer. If you don't, let me know. I will get you one. I will bring it to you. So when you do it, when you get out to do your cleaning, you're going to go to your book, you're going to find your sheet, you're going to do your weekly cleaning, you're going to document your weekly cleaning. I don't want to see, if we come in, when we come in, we'll be looking at these things when we do the patient control rounds. And one of the things I'm going to look at is your sterilizer logbook. And if there's a week that's missed, it's wrong. It needs to be done. I don't care that you were off. Somebody else needs to be your backup. Needs to have had it done. Okay. I've redone the monthly log. In your logbook, the sheet that says monthly autoclave maintenance, it has your date, it has the letters A through K. I want you to take that out of your book and get rid of it. We're not going to use this. the sheet that you now have, that I put in your packet, and everybody that has an autoclave in their clinic, I've got packets for you, and I want to give that to your lead nurse. So on each lead nurse that has an autoclave, I want you to see me before you leave, and I will give you your packet, complete packet for your logbook. The sheet that you now have for your autoclave maintenance goes through each step. It will also have your date at the top. You'll have a sheet for each month. And I want you to fill in the date that you do the monthly cleaning, which is every 28 days. Your autoclave will automatically tell you when it's time to be cleaned. It'll say monthly maintenance needed. That's when you do your monthly maintenance. I want you to initial each step that you do, even down to where you get to where it says check the pressure relief valve check. From just when I go in and talking to different clinics, I'm being told nobody is doing that. It's to be done monthly.
Doing what? I'm sorry, doing what?
The pressure relief valve check. And I've given you instructions on how to do it. For those of you that have the newer models of the M9 and the M11, this is for your newer models.
Okay.
If you have the piece that has the metal piece on the top, like I know the dental clinic does, they have that older one. If you look in the operations manual, if you have that older model, on page 21, it starts giving you the instructions for the pressure relief valve in your operation manual. And in your packet, I've given that to you. So that's how you'll do your pressure relief valve check. But I still want you to initial that it's been done. The steps are basically the same as far as the pressure relief valve check. The only difference is how you do it, where you lift the valve up to do the pressure relief valve check. For you to have the silver piece on top, you have to take a screwdriver or something, some object to lift it up. But that's the only difference in the maintenance procedures that I've given you. So these steps should kind of, even for your new person, you can follow this. We're going to watch a video in a minute that gives you instructions that walks you through it, demonstrates it, how to do the monthly cleaning. So take these, put them in your red book as well. And after you complete it, signature. So you're going to initial each step that you've done, and then you're going to sign it at the bottom. And save these pages. Don't get rid of them after you've done it. All right, I'm going to start the video. I'm going to walk you through the steps.
However, always refer to the appropriate technical documentation for the complete list of instructions, safety alerts, and sequence of procedures before conducting any service or maintenance operations. Every 28 days, the autoclave will automatically display the Perform Monthly Maintenance message. This is a more thorough cleaning of the unit and involves multiple steps. Clean the chamber and plumbing. With a cool chamber, drain the autoclave's reservoir and refill with distilled water. Add 1 ounce of Speed Clean autoclave cleaner directly to the cool chamber. This is where you load your instruments for sterilization. Run 1 pouches cycle, but push the stop button when the drying cycle begins. It's not necessary for the dry cycle to run during this maintenance. Drain the reservoir again and refill a second time with clean, distilled water for the rinse cycle. Rinse by running 1 unwrapped cycle. Push the stop button when the drying cycle begins. After the cycle has completed, drain and fill the reservoir with clean distilled water, then allow the sterilizer to cool. Remove the trays and tray rack and wipe with a damp cloth. Next, remove and clean filters. Remove filters by pulling upward and twisting slightly. Filters should be cleaned by washing with a mild soap and distilled water solution. Use a small stiff brush or an ultrasonic cleaner to remove stubborn deposits.
I want to pause it. You see that they're using a brush when they're doing their cleaning, and I don't know that everybody is in their clinics, and some of the brushes that I've seen look like you've had them for 20 years. In each of the packets, I've included the brushes that for you to order. They are a reuse brush. They come 12 per pack. It's going to be in what I give to the lead nurses for the sterilization, and I want everybody to order the brushes. You're going to pick 1 brush to do your cleaning of your autoclave with, and you're going to save another brush for the cleaning of your instruments. So, and then you're seeing them use the wipes. I've also got in here is for you to order the Chem wipes. they're cheap. We can order a box at $3.94 for one box, and there's 119 wipes per box. Or there's a case of 15 boxes per case. I think it's like $53 for the case. This is what I want you to order as well, the brush and then the Chem wipes. The Chem wipes you use for your cleaning of your autoclave. You can also use it for cleaning your instruments. So everybody, it's in your packet, please order it, or give it to the person that does your ordering.
For cleaning, rinse the filters with distilled water and set them aside. Wipe the inside of the autoclave chamber, being careful not to damage the heating element, steam temperature probe, or water level sensor. Reinsert the filters into the appropriate holes by pushing downward while twisting slightly. Reinstall the tray rack. Next, remove and clean the door and door dam gaskets. Remove the door dam gasket, door gasket, and then the gasket ring from the unit. Clean gaskets and ring with speed clean, distilled water, and a soft brush. Inspect the gaskets for damage, shrinking, or swelling. Replace the gaskets if damage is apparent. Press the door gasket ring into the channel in the door gasket and place the door gasket back into the door. The next part of the required monthly maintenance involves verifying proper operation of the pressure relief valve. Since high pressure and temperature steam will be vented from under the autoclave during this check, place a rolled towel around the bottom of the autoclave to act as a steam barrier. Press the unwrap cycle and then start. Monitor the display and wait for the pressure to reach 20 psi. When 20 psi is reached, pull upward firmly on the relief valve lever on top of the autoclave cabinet and hold it open for 3 seconds. Steam should discharge freely from beneath the rear of the unit. Release the lever quickly and verify that the valve is closed properly by noting that steam has stopped escaping. If the unit is still releasing steam, pull up on the valve lever again and release it quickly so the valve snaps back into position. Repeat this if necessary to make sure the valve is seated correctly. Press stop to cancel the cycle, preventing the unit from overheating. Allow the chamber to cool. If excessive force is required to open the valve, or if it will not reseat properly, contact your Midmark authorized dealer. When the maintenance is complete, the Perform Monthly Maintenance message will go away during your next sterilization cycle. M9 and M11s are designed and tested to provide exceptional reliability throughout their service life. To ensure integrity, performance, and safety of all major components, it is the responsibility of the user to have the sterilizer performance and operation verified by a Midmark authorized service provider at least every 10 years or 10,000 cycles, whichever comes first. For more detailed information about maintaining your autoclave, please refer to the M9 M11 Installation and Operation Manual. For further support, contact Midmark Support Services at 1-800-MIDMARK.
All right, everybody has an operation manual in the back of their red book. Familiarize yourself with it, look through it, it gives you some really good information. One other thing I wanted to mention, when you're doing your spore testing, I've noticed some people are reading it 24 hours, some are reading their spore test at 48 hours, some are doing it both. When you read your spore testing, it's based on which of test 3 in the test scores that you have. If you have the 1261s, then it's a 24 hour. If you have the 1262, it's a 48 hour. And in your indicator book, where you're doing your logging, you need to check which ones you're doing. Which spore testers you have. You have the 1261 or the 1262. If you change to a new one, if you were using the 1261s, now you're using the 1262, you need to go to a new page. And then mark that you're doing the 1262. Then you know, if you're using the 1262, you're going to read your spore testing it at 48 hours. Any questions?
I have a question.
Yeah.
Right here where when you do the pressure relief valve check, we don't have towels in that clinic.
Yeah, that was-
Our service away, so.
That was brought up. What the dental clinic is using, they're taking like the chucks and just rolling up the chucks to where you have the paper, not the plastic side, but the paper side, just roll them inside out and put the layers around it. And then I heard some of them were worried, well, I'm going to get burned when I do it. When I release that, lift that valve, I'm going to get burned. That's not where your steam comes. Your steam comes from the back at the bottom.
And I've noticed that she had a glove on like you do dishes with. If we don't have those, we can use our regular gloves?
No. You need to, I guess,
That's what I'm talking about, the disposable gloves, we can use
she's talking about
those.
the gloves like they use with their patients. Or do they buy like a kitchen washcloth?
I mean, just to clean it with. You know.
Washing.
The only problem, like, we're all supposed to be learning and switching it out, we need to find out more other than
We'll look for it, we'll look at that. We're gonna get in there clinic.
And if there's any maintenance trouble, just tell them a little bit about how to send in, an email about the repair.
Repair requests for broken equipment, they can find that on SharePoint, correct? For the broken equipment, there's a broken equipment form.
Email you about it.
Can't hear you.
I said, if they can't find it,
Yeah.
come and email you, you'll email it to me.
Yeah, it is on SharePoint. If you can't find it, you can email me, you can email Pat. We can, send it to you. If you do have equipment failure, fill it out, send it in. Pat, you wanna elaborate on that? 'Cause I'm not as familiar with it as you are.
Let everybody know how to do that, the repair form that Larry has to have before they'll touch any kind of equipment anymore. But you also have it in the back of, this is not a new form either. It's in the back of your, business policy manual. Just all the way in the back, it's one of the policies that's on the table of contents for your business policy. Look through that, be able to find it and send all of that in. Those of you guys who've had things break down in the past year and all of that, you've used it, but make sure that you use it and let us know if your sterilizer is out, if you need a loaner and all that kind of stuff too, because with Larry knows, they're not gonna replace your equipment until they get your equipment in, they'll send you a loaner out. That's a check and balance for them. But we also need to know if something's
Yes.
out of service, so if a provider is calling us complaining about something, we don't know that y'all are minus something unless you tell us. And going directly to them doesn't help us know what kind of replacement stuff we need.
And Larry has said, please don't just tell him in passing as you see him walking down the hall, hey, my sterilizer's broke, hey, my blood pressure cuff's not working. He doesn't remember. He said, you send him an email.
Carla, is our office manager, and we had, 3 times back to back to back. She did everything as far as she got the form, we filled it out. They came, they got it, they replaced us twice they replaced us with a
See,
loaner.
we didn't know about that, Tammy, so
No.
you as the lead nurse there, you copy us on it, so we'll know what's going on with it, because sometimes the guy who comes and gets the biomed person, I'll meet him there and say, you show me what's wrong, and blah, 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 blah. Happened it 3 times if there's
Well, I mean, no, the loaner they gave us broke. The loaner they gave us broke. They come and got the loaner and gave us another loaner until ours was fixed. But it worked out really, it was smooth as silk.
Okay,